If we're talking about lens replacement, then there are multiple advances in the lens implant technology. For example, not more than 15 or 20 years ago, we didn't have lenses that could provide a range of vision for people. So we have implants, for example, that are trifocals that can correct far, arm's length, and close. So rather than wearing a pair of trifocal glasses or lineless bifocals, you can wear an implant in your eye, and you no longer have to look up and down in order to be able to see at different distances. You just look and then you see. We have lens implants which can correct astigmatism. That's one of the most common things that we see people have. And in the past, we wouldn't have been able to correct it, but today we can put in implants that can correct their astigmatism, which just means the eye is kind of out of round. And that allows that person to see without the need for glasses, far away, or if they want a lens that provides a range, we can put one in that will also improve the range or depth of vision as well. So there are lots of lens implant technologies, and they continue to improve. LASIK is no longer the procedure that it was, say, 20 years ago. Patients would often say, yes, I can see better without glasses, but now I find myself not being able to see as well at night. And that was true for early generation laser technology. That is not what we deal with today, at least we don't here at Vision for Life. So the laser that I use, for example, which is called the WaveLight EX500, one of the most advanced lasers anywhere in the world, it is a laser which can create so much improvement in one's vision that it can actually have people say, I see better at night. In fact, the majority of people after their surgery, 6 to 12 months later, will say, I see as well or better at night than I did before when I was wearing my glasses or contacts. Another example of how that particular laser can improve outcomes is what we call topographic guided LASIK, or Contora. If you imagined you have two people and they both wear the same glasses, if that other person put the other person's glasses on, they probably would see fairly well. If those two people had LASIK using basic technology, the laser would just simply correct the vision that the eyeglasses were providing. In other words, you'd put the eyeglass prescription in the laser and the laser would fix it and both people would see better. In fact, though, there are differences between those two individuals that the glasses, contacts, and that kind of basic LASIK procedure are ignoring. There are differences that are on the cornea of the eye, for example, the very front window of the eye, that make your eye different than anyone else's, even if you two wear the same prescription contact or glasses. And with this particular laser, we have the ability to go and make a measurement of about 20,000 plus points on the cornea, see where those differences are, and then that automatically gets programmed into the laser. So the laser now can figure out how it can not only correct the eyeglass prescription, but correct for those deviations, what we call higher order aberrations. So what we see with that is that not uncommonly, not only will the patient see better after they have their laser, but they see better than they did with their glasses or contacts before the procedure.